Okay, so my name's Hazel Jones. At the moment I'm a PhD candidate through the University of Southern Queensland, but I also work and have done for the last 20 odd years in educational support roles, so educational designer, educational support. I'm now a learning and teaching consultant, but at a different university. I work at Griffith University, study at University of Southern Queensland. So as I start this presentation, I'd really like to acknowledge the support of all my supervisors, Marcus Harms, Katie Burke and Nick Kelly, but also just as importantly, the participants that have worked with me over the last 4 or 5 years, the staff who completed the survey for the initial part of this study, which isn't the focus of the talk today, and also the academics who gave very freely and generously of their time and perspectives around what learning analytics is and where we should be moving with it. So the problem that I'm looking at here was that at USQ, as at many universities, there was low levels of use of learning analytics by our academics. A number of reasons for this, and part of it is, do we know what those reasons are? And as I said, the context for this study was at USQ, which is a regional university. They have a very high percentage of online offerings where students are fully online, but all students, even if they're the face-to-face students, do engage a lot with the online environment through the LMS and a lot of other platforms. And the university is at the very initial stages of learning analytics adoption, using mainly data from LMS reports and not much consolidation around that either. So that's the context with which I was working in. And so why this study I consider is important is that academic staff are a key group of the stakeholders, partly as Shane mentioned in his keynote, but for them to really engage fully in learning analytics, they do need a lot more knowledge, skills, motivations and time. And this study is looking at both the consideration of those socio-cultural aspects of learning adoption. Why do staff adopt or not adopt? So my study is around the design and trial of an implementation plan for staff in the uptake of learning analytics, and I used a design-based research approach. I've now finished all the data collection and I'm busy writing up with an aim to submit by September. So I'm very heavily into this at the moment. So phase 1, looking at the problem, and did a survey of all academic staff at the university, some interviews with a small group of staff and analysis of usage data in the LMS. But that usage data was usage data of the staff. If the staff that were involved and they wanted to do that, they were looking at their courses and their students, but I was interested in how they were engaging in the LMS, which in our case was Moodle. Then phase 2 was the development of the implementation plan using Behaviour Change Wheel, and that's what I'm talking about mainly today. Phase 3 was then implementing that Behaviour Change Wheel plan, firstly with a workshop with expert consultants who gave me lots more input on how it could be tweaked, and then 2 iterative cycles of the trialling and refinement of the plan, which happened last year, and now I'm into that final phase 4. I acknowledge quite openly that there are quite a few limitations with this study. It was one university, a small number of participants. In phase 1 there were about 100 people that responded to the survey. There were 8 staff who were involved with interviews over a period of about 18 months. And then in phase 3 of the study, because there were no participants in phase 2, that was my designing phase. In phase 3 there were 20 people involved, 7 from the expert consultant group, 6 in iteration 1, and then another 7 in iteration 2. The learning analytics were restricted to data from the LMS, as I said, that was Moodle in our case, and that was because that's basically all the staff had access to at that particular time. But wherever possible, I did direct and suggest other sources of information that they could consider when they're looking at their learning analytics and trying to work out whatever question it was that they were asking. Though we did have to acknowledge that access to some of that data was difficult for them. So how did I go about this? I came across this framework called the Behaviour Change Wheel. Now this has been very heavily used within the health and medical fields for many years now. This evolved roughly at the same time of learning analytics evolved back in 2011. The paper I'm referring to here is actually the book that the authors wrote, but they had papers out before that. So there's parallels in the growth of learning analytics and the Behaviour Change Wheel. The original paper that they wrote has been cited over 3,500 times, and if you do a search for Behaviour Change Wheel anywhere, you will see the depth and variety of ideas that are being used with this, but very few, if any, within higher ed and or learning analytics. So this is a different way of doing things. And one of the examples that they use that's very topical at the moment when they're talking people through and working through the Behaviour Change Wheel is the importance of hand washing in hospitals. So I'm sure that's something that everybody can refer to. And you can see with this Behaviour Change Wheel that there's 3 wheels within the wheel. The first one is the inner wheel, where they're talking about the capabilities, opportunities and motivations of the people that you're working with. So this forms the inner wheel, and they call that the COM-B model because it's the ways in which the capabilities, opportunities and motivations affect a person's behaviour to change. The middle wheel, the red wheel, are the intervention functions, and I'll explain these two in a bit more detail as we move through. And then the final outer wheel is actually out of scope of my study, but it's where the legislation and rules and policies and things can be set, which was, as I said, quite beyond my PhD study at this stage. So the Behaviour Change Wheel, one of the things that they say very early on, they acknowledge that, as it says there, behaviours are part of a system. They don't occur in isolation. And this again links back to Shane's comments about complexity theory. And a staff member in this case, the learning analytics or even the teaching that they are doing is only one part of their role as an academic. They also have their research role, they have their admin role. And then outside of that, that person is part of a discipline which also influences them. Then they are maybe a father or a peer or a mother or a sister or a daughter, and that they've got a whole life outside of university. So we know that this is just one very small part of the very small complex situation that is a person, and then there's the whole complexity of the institution within which they work as well. But the Behaviour Change Wheel was based on 19 frameworks of behaviour change, and in any of the papers on it you will find some of those mentioned. But for this particular study, the target behaviour was how to get academics to engage more with learning analytics to inform and enhance both their teaching practice and their course design, with the ultimate aim, of course, of optimising student learning. So the Behaviour Change Wheel is a very pragmatic process, and they set it out very nicely for anybody that wants to pick up the Behaviour Change Wheel and work through a process. So it's defining the problem, selecting the target behaviour, as I've already mentioned, and then identifying what needs to change. So that's where we're looking at what are the capabilities, opportunities and supports that are needed, and then identifying the appropriate intervention options, and then finally, how do you actually implement those changes through an intervention. So as I said, at the core of the Behaviour Change Wheel is the COM-B model, which is looking at capabilities, motivations and opportunity and behaviour, and the intertwining of all of those 4 concepts. And we don't have the time right now to go into that in more detail, but I can certainly answer questions on that later if you like. So you can see as well that in the model, for each capability, opportunity and motivation, the authors have split this into 2. So for example, for opportunity, the social opportunities, which is the interpersonal influences that they're working in. There's also the physical opportunities. So that's the affordances from the environment in which they work. Motivation can be either automatic or reflective. where the reflective is involving the plans and the self-conscious intentions of the people, and the automatic motivation involves the emotional reactions and the desires, the wants and needs, the impulses and the reflex responses and the drivers. And then for capability, there's the psychological capability. Do they have the appropriate knowledge or psychological skills to undertake the behaviour that's being wanted to change? And physical capability, which in this case isn't a factor at all. You don't need any physical strength to adopt learning analytics. So that was something that in this particular case wasn't a factor. Then if we move on to that red wheel, this is the intervention functions, which the authors refer to as broad categories of means by which an intervention can change the behaviour. So this is how we make it happen. So within an education field, you can see that there are 9 different intervention functions there, but there's 2 that I don't think we would ever use within an education field, and that is restriction. For example, with smoking, making the cost and the taxes on cigarettes higher so that less people will take up smoking, or coercion isn't something I would hope that we would ever do with an academic when we're trying to get them to take up learning analytics or any other behaviour in an educational institution. But all of the other intervention functions there are things that could be used within an intervention. And again, I can talk in more detail about them later. So what I did through phase 1, where we had a survey of 100 people, as I said, interviews that spanned 18 months with 4 groups of 2 academics, and then some of the LMS data. Some of the things that came out of that in terms of capabilities, that there is a huge lack of knowledge in our academics, and that's knowledge on lots of different levels. It's the tools and reports that are available to them, it's how to interpret the data, and then how to implement appropriate actions when they've been able to analyse and interpret the data. Time, as we all know, is always one of the big things that comes out as a barrier for anybody to engage with learning analytics. Now, some of the log data tended to suggest the amount of time that staff were spending within the LMS. Some people were on the LMS every day of the semester for multiple hours and sessions. So sometimes it may be that it's more about not having enough time, but how to use their time more effectively. So all things that could be taken into account when developing an implementation plan. In terms of the opportunities, staff were asking for data to be available in an easy accessible format, something that they could get to easily without having to drill down, without having to have too much input in, preferably in a push situation rather than a pull situation, which certainly wasn't the case in our particular situation. And then they want training and support in all of those layers that we've already talked about. And for some people, the support and getting other people to do it for them was more important than the training. But my firm belief is that the training and the staff capacity is the important part of this, because the academics are the ones that are in there in the course. They understand the context and they're the ones that would be implementing any changes. So it's very important to include them and build their capacity. And the final thing was in motivations. What motivates a staff member to want to look at learning analytics? And again, there were 3 areas that came out of that initial study. Students, what resources are my students looking at? How are my students doing? How many times have they looked at this? Who's talking to who? Teaching practice could be along the lines of, how do I change my course design so students do engage more? How can I make better use of my time? And finally, academic recognition was important for some people. How can I get publications out of this? How can I use engagement with learning analytics to improve my chances of promotion and getting teaching awards? So there was a range of motivators that were coming in there, and most staff sat somewhere in this intersection. Nobody just was there about the students. Nobody was just about academics. So it's understanding that complexity that can help you when you're talking to academics and helping them to engage. So in this case, putting all of that together, what I came up with was the 4 components that were most important for my particular situation at that particular time, were the psychological capabilities, the physical opportunities, the social opportunities, and the automatic motivation. And you can see more detail there of how that panned out through the questions to the survey and the interviews, and gave ideas of what would be useful in an ongoing implementation and support plan. So what they do with the behaviour change wheel, they say, okay, you've worked out what your COM-B models are. Which of the intervention functions are going to be most suitable for you? And so this table has been developed and is freely available through their work to help you decide which of the intervention functions are most particularly useful for your particular case. And for here, where we've got psychological capability, etc., the 4 that came out for me were the training, the environmental restructuring, the modelling, and the enablement. So they were the 4 intervention functions that I included in my intervention plan. So just taking one of those as an example with enablement. Enablement's about reducing barriers and action planning and the practical support. So what I did in my plan, that I thought about how could I support each participant to determine the specific question that they wanted to investigate. And I always started with the conversations with the academic about what is it you want to know about your course or your student. And then I go through 5 whys. Why is that important? Why is that important? Why is that important? And try to get them to drill down to what it really was, because often the question would be, why aren't my students engaged? Well, there's a lot of conversation that can come from that. What do you mean by engagement? Why is engagement important? How are you going to measure engagement, etc., etc. So that was the first level, and then helping them to plan how to use learning analytics to inform their investigation, then for them to design and implement an action, which could be as simple as changing the way they put up the initial post to a discussion forum for a welcome, or it could be something much more sophisticated and complicated, depending on the situation that they were in. And then how are they going to evaluate its effectiveness at the end of the plan? So that how I went about this, that I worked with small groups, and in the first iteration it was 6 staff, and in the second iteration it was 7 staff, working over the period of 1 semester, which is 20 weeks. We started with a group meeting, which was an intro and an overview, and then halfway through had another group meeting and finished with a wrap-up meeting. And that's bringing in the intervention functions of enablement, modelling, environmental restructuring. Between those 3 group meetings, I'd have individual sessions with each of the participants. And in the first iteration, I made those meetings 1 hour. And very rarely we get to 1 hour. So in the second iteration, I made them half an hour. And in most cases, we went well over half an hour. So just that little bit of tweaking there made a big difference to how staff perceived it and how much they engaged as well. And that's taking into account the 3 intervention functions there. And finally, I included a support site within the Moodle LMS that provided a lot of resources and discussion forums, some private areas and some public areas, and that again was part of the training and also the modelling. So very briefly, as I said, I started with an expert consultant group, and I ran a 2-hour workshop with educational designers and academic developers to get their feedback. And because one of the things moving forward with this, that they are an important stakeholder group as well, who will need to be involved to help scale this type of process upwards. And then the 2 iterations that I ran last year. The data, again, I used transcripts from all of the meetings, and I'm starting to do the thematic analysis, both inductive and deductive analysis from all of those meetings, using the log data from the courses in which the participants taught. And again, that was just of their interactions, and also log data from the staff interaction in the support site that I set up, and finally a final reflective survey. Now, this particular paper being a very short paper only had a little bit of that data in it, so I'll just briefly go through some of that. For the first iteration, this is simply a comparison of how much time the staff spent looking at learning analytic reports and tools within their LMS prior to this intervention and then during the intervention. So the time there is in minutes, and this is, as I said, is over a 20-week period. So not very high levels of engagement, but you can see particularly with Leslie, they doubled their engagement, and these are all pseudonyms and deliberately chosen as gender neutral. The only person who went backwards is Kendall, and they did explain often with me, I wish I had more time. I haven't put in the time that I want to do with this. That's a very raw baseline information, which looks promising. But what I need to do is go back and have a look. Does it mean that they're engaging more with a particular report, or they're now looking at some of the more deeper reports that give them more detailed information and specific information about the student? So a lot more analysis to do from that area. And then the final thing that I wanted to have a look at is some of the comments that I got in the final survey at the end, and I've included in here comments from both iterations from last year. So you can see there lots of different things that they found rewarding, the variety of modes of engagements, the being able to revisit it, so the temporal nature of the intervention, that they were able to improve and monitor engagement of their students, it advanced their knowledge, it was practical advice, they had a better understanding of what students were doing. There were, of course, some things that they found frustrating, and guess what? Most of them are related to time. Not having that time, being able to dedicate the time to this that they wanted to dedicate to it, was the main thing that came through in all of this. And you can see with the central one there that that's obviously someone who understands quite a bit about how some of the data analysis and wanting to really be able to get in there and play with the data and find things out for themselves. So some high levels of engagement starting to happen, but just not enough. And then finally, the most helpful aspects that they were talking about was the breadth of how it could be used, the personable one-on-one engagement, but also the conversations with their co-participants and being able to engage with others, share stories, the personalisation of the support, and having someone available, as well as having the Moodle page available. So lots of things that they found out of this. So where does this leave us in the field? I believe that this is an approach that can be readily adapted in a range of contexts. It's not tool or platform dependent. It doesn't matter what stage of implementation you are, you could still adopt the behaviour change wheel. You would end up with different results from the COM-B approach, and you would come up with different intervention functions to put in, but you would be putting together a personalised plan that works for the staff in your particular situation. It's an easy to follow process, it's got a strong theoretical grounding, it's scalable, and there's a focus on pedagogy. So I'd invite anybody that's interested to talk to me more. I'd love to see this operated in other situations. I'm already starting to, before we got hit by the virus, to run a similar process with a group of staff at my current university, and hopefully there will be other people that are interested in taking this up. So thank you very much.